Good morning, everyone, and welcome to another episode of CrohnsCast Live. Tonight we're going, or today even, it's actually really early morning. We're going to be sitting down with Sarzi, and we're going through her journey with IBD and focus on her women's health. So we're just going to welcome into the room, Sarzi. Hey,
Beautiful,
Sarzi, how's it going?
Good. I'm well, thank you. Thank you so much for having me. I'm really excited to share my journey and what's been happening with me, and just hopefully inspire some other women and men, all over the world. So thank you so much.
So what time are we on over with you?
It's 3:30 p.m. on Saturday.
Oh, a lovely Saturday. How's your Saturday been?
It's been good. What have I done? I slept in. And then I went to a birthday party so I live in Adelaide in South Australia. So I went to one of our wine regions, and we just had a picnic in the parks. That was good. And now I'm back here talking to you. And then tonight I'm going out for dinner. So yeah, be nice.
Oh, nice. So for the guys that maybe don't know who you are, do you want to give yourself a quick introduction?
I can do that. So my name is Sarah. Well, I go by Sarzi. That's my nickname. I'm 35 years of age. I'm a palliative care nurse, so a specialist palliative care nurse. I work in the community and look after people at home, which is absolutely awesome. And one of the reasons why I became a nurse is because of my Crohn's diagnosis. So I was diagnosed with Crohn's disease when I was 13, so 1998. So, there weren't too many fancy medications around like there are now. And I actually had a bad experience when I was, 15, where I had a nurse who was really quite horrible, made a few comments about my weight, being on steroids. And, you're going through puberty and learning who you are as a person, as a female, and I really didn't like that experience. So from that, I took it and I really wanted to be a nurse, and a nurse that would help others and just make their experience more comfortable. So that is actually one of the main reasons why I became a nurse, I think, being sick. So that's me, I suppose. I got married this year.
Oh, congratulations.
January. Thank you. So we got married pre-coronavirus, very lucky. So we had a great
one of the few
party,
successful 2020 weddings.
Yes, very, very lucky. And next week's actually my 11th stoma birthday. I've got some balloons there in the background, one. I've been celebrating all month, and I went out last night and had a few drinks, so bit worse for wear today, but I always celebrate. Susie's my stoma, so I named her because when I had Susie, I have a little sister who's 20 now, but she was 9 at the time. So I really wanted to make her feel comfortable with me having a bag. So we named Susie because I actually had a stoma nurse called Susan, and Sarzi and Susie is pretty cool. So everyone loves Susie, and she gets mentioned on birthday cards, Christmas cards, you name it. Like, she's just part of the family. So it's a lot easier, I think, when you name your stoma to share it with other people. So it just makes people feel a little bit more comfortable when they want to ask or talk to you about it. So, yeah, that's me, really.
No, that's wonderful. One of the things that I like to talk about with people is how they went through and got diagnosed. So like it's going obviously quite far back for yourself, it's 22 years now, roughly, isn't
it? Correct. Yeah.
So can you cast yourself back to, I'm assuming you were 15, around about that age?
I was 13 when I got diagnosed.
Can you cast yourself back to that? And just let us know what was it like? How were you going through and like the experiences of being diagnosed?
It was quite scary because I didn't know what was happening. So to be a little bit graphic, I suppose, I was going to the toilet quite a lot, and there was a lot of blood, and I didn't, it's not normal at 13 years of age. So I think the first test I had, obviously I saw my GP, and I had like just a little scope where they took some biopsies, and then I got referred to my gastro, who is an absolute legend. He's retired now, funny enough, obviously, because it's so many years ago. It was really scary. I didn't really know what was happening. My nana has Crohn's disease and my auntie, so I knew a little bit about it. But yeah, just tests after tests. And I think then I was put on steroids and cilazapyrin. They were my first medications, I remember. And then I never had the IV therapies. I think they will come, like I remember infliximab was coming in as I was maybe 15 or something, 17, something like that. But yeah, I was just I just stayed on oral medications, and I can remember all my medication. I'm not on any medications now, actually. So I'm very lucky. But yeah, it was very, very scary, very daunting. And I suppose you sort of think, at 13, well, why am I sick? What have I done wrong? Or you don't, you want to experience and enjoy other things that other kids are enjoying. I mean, I still played a lot of sport, and I was still able to maintain a healthy lifestyle, but obviously food's really, at that age, you want to go out and have, dinners or whatever with your friends. So I just had to be really careful. And you learn that as you go. So yeah, that's probably the main thing I can really remember.
Yeah. So like at 13, I mean, that's an awkward age for most people. But I think, and I'm talking from obviously a very significant lack of experience, but I think it's also a very awkward period for womankind and girls of that age, because a lot of girls, to my knowledge of my sisters, tend to go through and start their menstrual cycles and things around that age. Like, how did that impact for you? And was that an issue for you during your diagnosis? Like, how did that? Because that's quite a huge time to then be going, oh, by the way, you've also got a Crohn's disease.
Definitely. That happened simultaneously. So I was 13 when I first started, my cycle. So I know that always around that time, my Crohn's would flare up, and I would be probably, I think that happens anyway with women and in general, regardless if they've got a bowel disease, that, their bowels get a little but turned upside down when they're going through their cycle. So it did affect me. I would be, on the toilet or, having the bad pains. You're getting both sort of cramps, but I just took it as it come. My parents they really taught me, this is what you're dealing with. You don't really have a choice. It was, tough love, but not in a mean way. This is what you're dealing with, and you just going to have to deal with it. And they've always taught me that, and I'm really grateful for that. Actually, my little sister, who's 20, she's been diagnosed with Crohn's now too. So she's lucky she's got me, and Mum and Dad said the same thing to her. This is what you've got. This is how we're going to deal with it. And she's been really so.
No, and you know what? It's awesome, I think, to be able to have that perspective for someone so close to you. Do you know what I mean? Like, so you're able to almost. I mean, obviously, it's not a great situation to have Crohn's and to have a younger sibling be diagnosed with Crohn's, but in terms of the value you can give them and the sort of foresight and perspective is well, you couldn't put money on it. What is it like in Australia as a teenager getting IBD? Like, what's the treatment like? Because obviously over here in the UK, we've got an NHS, and I understand we're quite unique with that within the sort of global health industry. I'm not really very aware of the Australian healthcare system. I was just wondering, like, what was that like? Did that put a financial stress onto your family, or was it able to be paid for by sort of government, or what was the score with that?
Yeah, so in Australia, like the NHS, we have Medicare. So everyone has access to free public health. I have private health insurance, and my parents do as well. So I actually went through the private system. So normally people my age, or when you're diagnosed that young, you would normally go through the public system. But my mum was it's actually funny. My mum was so desperate to get me into a gastro, and she was looking through the white pages or yellow pages, try and find something. Obviously, the internet wasn't a big thing then. Trying to find someone to hook me into, because my nana's gastro was, full, booked up for months. So she found Dr. Johnson was his name, found him, and the lady, the receptionist on the other end was like, I'll get her in straight away. She's so young. So I literally got in within a week, I reckon, of mum speaking to Marie, her name was. So I remember names that people are quite significant. When you go through something like this, you always remember those people. And he has daughters my age who I actually ended up nursing with at one of the hospitals here in Adelaide. So I got in and went through the private system, which is uncommon. In terms of medications, I was on some medications that were really expensive, but we have the PBS, so the pharmaceutical benefits scheme, where they can be discounted and you get an authority through the government. So through Canberra, which is the capital of Australia, so you can get them cheaper. So I was never burdened, in that respect. So I was probably quite lucky, I suppose. But if you are diagnosed at a young age, you can still get access to free public health. So that's amazing. So we're very lucky in Australia, I think, for that. So that's a little bit of
it sounds like a fairly balanced approach to healthcare, in sort of my opinion. What about private healthcare? As an Alex, you mentioned you got now private healthcare still. And this is a bit of a selfish question, because obviously I am looking at immigrating to Australia as a permanent resident sort of around 2022, 23. But I was wondering, obviously I would like to have private healthcare whenever I got there, from what I know of the system. But I don't know how much does your Crohn's impact that premium?
Doesn't. I don't really. Well, for me, it doesn't. I don't know. I haven't really. You do have to disclose them, but I pay $250 a month for my insurance. Some might say it's a lot of money, but to me, you can't put a price on your health, so I will pay that. But I've got extras like physio cover and, optometry, all those sorts of things. Most people just get hospital cover. The reason why I've got it is because I can choose my specialist. That's one of the main reasons why I've got private insurance. And I'm trying to have a baby, so I wanted a private gynecologist, obstetrician I could choose and go through, that means. It doesn't, I don't think it's impacted. It never has. So I don't know.
Well, that's put a worry to bed for me then.
No, I wouldn't worry at all.
Because that's one
honestly.
of the things in the UK for private health. I'm not sure, maybe it's because we've got the NHS, but in the UK, it seems to really impact if you've got an ongoing health issue. They either won't cover you for it, or they charge you through you're talking £500, £600, £700, and you're like, it's not worth. You know what I mean? You're like, well, I can't actually physically afford to pay that. But slightly taking us off topic. You mentioned that you are about to celebrate your 11th stoma birthday.
Yes.
And what was your journey arriving at needing to have an ostomy? How did that come about?
All right. So I've had multiple admissions for a remission. My first one was when I was 15, so that was the year 2000. Actually, I got to negotiate that with my doctor. So it was just after the millennium, I was like, I really want to celebrate New Year's, and he let me do that. So I went in on January 3rd, and my birthday's in January. So I got out just before my birthday. So I was lucky. I had 2 weeks stint, and then was in a remission period, on and off medications, steroids, etc. Then my next one was when I was in year 12, so my final year of high school. I was really sick, and I think stress played a lot to do with that. Obviously, when you're stressed, your bowel gets affected, and I was just running back and forth to the loo, and yeah, it wasn't a fun time. But after that period, I was really well up until I was 20. What, I want to say 22. I actually had pyoderma gangrenosum, which you may or may not be familiar with, which is basically ulcers that they stem from autoimmune diseases, and they're quite common in Crohn's and colitis and other autoimmune diseases. But I got mine on my foot. None of the doctors knew what it was initially. It was it's really quite painful. So I had a skin graft on that, 2 debridements of the wound. I was in hospital for a month and I actually had to learn how to walk again. So that was really tricky. So that was when I was 22. And then I got over that, fine, working as a nurse, I just started after my graduate, that was in my graduate year as a nurse.
That must be really scary.
In 2000, well, yeah, it was because I was a nurse. I already knew what was happening and I knew what they were giving me. It's hard being the patient when you're a nurse. Yeah, it's really painful. That's the most thing I can you should Google the images when we get off here so you can see. I'd show you my foot. It's all there's just a massive scar now. I won't get it up for you. It was really painful. So now I've actually got arthritis in that ankle, which is only arthritis and colitis. Well, actually, I should take a step back. I was diagnosed with colitis when I was first diagnosed, but it wasn't until they removed my bowel they were like, it's Crohn's. So now they sort of call it Crohn's colitis or indeterminate, but I don't have it anywhere else in my gastrointestinal tract. So it was just the main, like the large bowel. So getting to the point where Susie was born, I was losing weight, and it was really odd because I was still, functioning, but I was getting a lot of pain. I was like, wow, I can eat weight. Awesome. As a girl, you're like, woohoo. Anyway,
so how much weight were you losing? Were you in a really significantly low weight, or?
Yeah, but I'm not a big person. Yeah, I reckon it was 5 to 10 kilos I lost in a short amount of time. And I was like, oh God, what's happening here? So I went back to see my gastro. He said, look, you haven't had a colonoscopy for a while. Let's do one. So we did one, and Dr. Johnson, he was so sweet. He was almost in tears telling me the results. He's like, I couldn't get through with the pediatric scope. You've got so many strictures there. All the scar tissue had obviously healed over from the previous ulcers that were there. And he sort of said, look, I think you have to go and see a surgeon. And I always probably knew that one day I'd have to have a stoma. So at 17, when I had that admission in year 12, they did say to my mum, look, I think Sarah will need a stoma. I think we should probably look at surgery now. Mum's like, nope, she's too young. She needs to live a little bit more, learn who she is, et cetera, et cetera. Let's just keep trying medications. And I was happy with that. I didn't really want to have a stoma, that young. But, now it's the best thing ever happened for me. But I don't know how I would have handled it back then. So I think being older, so I was 24 when I had Susie, you sort of know who you are. I was really comfortable in my own skin. But yeah, leading up, it was just, I was really, really sick. I still worked like literally 2 days up until my surgery. I just fought through, and I thought, because I knew I was going to have a lot of time off work, and I love work. So, I had the surgery. So what they're actually going to do is a J pouch. But when they got in, they found a mass sitting at the back of my kidney and my bowel together. And they actually thought it was cancerous, but so I had to wait 2 days for those results, and they weren't, luckily.
Nothing like keeping you on edge.
Then what happened then? Oh yeah, so don't know if that's my connection. I'll keep going anyway. So I had they removed my bowel and left Susie there as a situation.
You're okay.
We are totally freezing up here. I don't know what's happened.
No, you're still good. You're still good on the stream.
I think my connection's okay. So yeah, I had they left Susie there, and I went on my merry way, and then just kept going back to see my surgeon. So yeah, they left Susie there, went on my merry way, and just went back, to have more conversations with my surgeon about what was going to happen, and left Susie there. But it wasn't until 6 months later that I was actually still using my rectum. So they left my rectum, and I was bleeding and had quite a lot of mucus. So what ended up happening was they removed my rectum in March of 20. What date? 20. Sorry, I don't know what happened then. 2010. They removed my rectum, so that's when I had the Barbie butt. So that was what happened leading up to it. I'm actually glad.
I do love how we've managed to cut. I do love how we call it the Barbie butt. Kind of.
I love it.
It intrigues me.
It's so cool. So yeah,
So when in the build up
honest,
to all this, was there a big concern about having an ostomy? Were you worried about having a stoma, or was it just something that felt like a natural progression for you?
I think natural progression. I wasn't, because I was a nurse and I'd looked after many stoma patients, I wasn't scared. No, I wasn't. I think maybe a little bit, image a little bit, I think I was worried about, but now I don't care. I love it because I know that I've got my life. Like I missed out on my early 20s, honestly. I couldn't go out. I couldn't travel like my friends did. So I've made up for that now. I'm still making up for it. But yeah, if someone said we'll do a J pouch or reverse, I wouldn't do it. Personally, I like having control over when I can go to the toilet, not having pains. I'm very lucky I'm not on medications. That might change for me, but when people message me on Instagram and say, I'm about to have a stoma, what do you recommend or what do you think? And I'll just tell them it was the best thing that ever happened to me. Like, hands down. I love it. I think most people say that. There's a few that don't, but for me, it honestly was amazing. Just, love it. Very
what
lucky.
sort of work do you do with patients that do struggle? Because I remember being on the ward and a number, certainly older patients, but I'm sure there are younger patients out there as well that maybe feel they've got their life ahead of them and feel that this is a huge disadvantage and a social issue for them. What would you, from a sort of professional or even personal perspective, like how would you coach someone maybe struggling with having an ostomy?
Well, that's tricky. I always like to get people to reflect on what they think life would be like for them if they didn't have it. I think they really need to think about, what it's like now. And for me, I suppose it was, running to the toilet. I had no quality of life, and I think that's what they need to focus on. The image and all those things will just come. That's how I would probably ask people to reflect on that and maybe tease out why they're feeling the way they are. I think it's really good to talk to someone, obviously professionally, about how they're feeling. But I do like to inspire other women and men about, living with a stoma. You can actually do anything. To be fair, I can do more than I could, than when I didn't have a stoma. Like exercise. I mean, I'd always exercise, but now I feel like I've got more energy. And I can go out, I can drink alcohol, I can, I couldn't do that. I can eat pretty much whatever I want. So I think it's good to focus on those things. That's how I like to share, and like through my social media, I like to share with people that I'm just like everybody else and I can do anything. So I hope that answers your question.
Yeah. So like with you mentioned that once you had your ostomy surgeon, you had a few checkups and a bit of a discussion, and then obviously you end up with your Barbie. But But one of the main
Mm,
things that I'm really interested in is you said that you made up for lost time. And sort
mm.
of what did that entail, and how did managing your now imagining Susie with that, how did that go along? How did your journey discovering that and doing all your traveling and whatnot?
Obviously, you have to adapt to it with traveling with a stoma and learn all the tricks of the trade, packing extra bags, packing extra clothes sometimes. I don't know, it's the control thing. Like Crohn's and colitis is so unpredictable. You do not know when you're going to have a flare. You do not know when you're going to poop yourself. Well, you do just before you're about to do it. I always like to make things fun and funny because you don't laugh, you'll cry. You don't want to be. I couldn't travel with and go. You'd have to take all the medications with you. That's okay, but I don't know. Being sick, the last place you want to be doing anything. You just want to be laying in bed or laying on the couch or whatever. So yeah, I've made up. I suppose traveling. I've been able to travel the world with Susie. It hasn't really. I suppose just packing extra things and making sure you've got all your supplies with you. That's one thing that and then going out, just being a normal person and going out for dinner, not going, oh, where's the toilet? Or I remember I used to have to think, oh, is there going to be a toilet? I mean, I still do that now, but if I can leave my bag a bit full and just change it when I feel comfortable, or empty it when I feel
Mm-hmm.
comfortable, it's the control thing, I think.
Mm-hmm.
I don't know. Do you
Totally.
find that? Do you find
What's
that?
your
Yeah.
yeah yeah, definitely having control back in your life is a huge factor. I think
Mm,
that's. Did you feel did you come off medication straight away once you got your ostomy? Or
I
yeah,
did.
straight away.
Yeah.
Did you feel like it was
Yeah.
a fog lifting almost?
100%. Yeah, not having to take your medications I was really bad at taking medications actually. In the end, I was probably a bit non-compliant, just because I was over it. Not very good nurse, am I? um, but yeah, I think definitely, that's another control thing, I suppose, just being normal. Like not,
But it's
I don't know, some people,
yeah,
yeah.
it's an interesting thought that like you're talking about non-compliance, and it is. I think when you're chronic disease, I think, is one of those areas. Like if you look at someone with chronic back pain, like sometimes you just reside to the fact that this is life and this is what it is, and actually, what's the
Mm,
point in this sort of stuff? And it's obviously, I think it's a really tricky time for patients, and we all cycle through those periods of where I don't know if you even call it self-doubt, but it's just like the reside in yourself that, well, and it's not a good place to be, but I guess it's just something that happens every so often. You kind of pick yourself up and you get through it. But one of the interesting things I'd like to know is when you're going on an airplane, what's your must-haves? What's in your bag?
Um, Wipes is a good one. I always carry a spare bag with me wherever I go. Except last night, I actually forgot. I got out the car and I was like, "Dad, I left my bag at home." I'm like, if I shit myself, we're going home. So but it was okay. I was fine. One hot tip. This is a bit graphic, but most probably stoma patients would know. You put toilet paper in the bowl first, right? You empty
Yeah,
your
yeah,
bag and then because the last thing you want is that you can't get rid of on the toilet bowl. Do you
yeah,
know what I mean? That's
yeah.
embarrassing. Like people coming, and I always bring perfume with me to hide the smell of the contents.
So many people do that as
They're
well.
my
I've now
bag.
got they got the posh. What is it? There's like a posh
Oh,
poo
VI
spray
poo.
thing.
Yeah,
That's the one. Yeah.
yeah. I just
I
use
can't believe
perfume.
that. That's got to be an IBD person that's invented that, surely.
Definitely, 100%. So I always do that. They're my top tips that I normally wipes or hand sanitizer, obviously, and the spray. But I do that everywhere I go. Like I always have spray in my bag or perfume that I can just hide the smell. So But it does have advantages. Like I've been at music festivals and I've gone to the security guard, like to try and sneak in the line. Well, my bag's full. I'm like, I've got a bag. I need to go to the toilet. And they let me in. So my friends love coming with me
Brilliant.
because we get straight in.
Get in everywhere.
Yeah, why not?
No, that
Use
is
and
that.
abuse.
There's not very many advantages, so you've got to take them where you can get them, I guess.
I think so too. Yeah.
So your journey to date, like, what's that taught you about yourself? What have you learned along the way?
That I'm stronger than I think I am. You know, I've learned that I'm very resilient, I think. That your life can change in an instant, and you know that you should always be grateful and make use of the good days. Because sometimes, you know, you never know when you're going to have a bad day I mean, I still have, I suppose if I get gastro, I get bad days now. I don't really get too many gut issues, but or pains or anything like that. But you know, if I get gastro, I'm knocked out and I'm, you know, flat out on the couch or whatever. So I think that you don't realize how strong you are, and looking back, you just think, oh, how the hell did I do that? Like you just do it. You're in the moment, and this is what I've got to do. I've got to get better, and yeah, that's probably what I've learned about myself. And I think, yeah, that I'm stronger than I ever thought that I would be, and I just really want to help other people be strong and be positive about what they've got and how they can, you know, share that with other people. So,
Yeah, and I think that's a really positive message for people that are just getting diagnosed and going through their own journey is that realization that you are stronger than you think. And I think that what's interesting is the number of people that I speak to that is how they feel, or that is certainly one of the top things that they've learned about themselves, is that inner strength that they have. And it's true, like, you know, you deal with a lot, and to come through it and survive it with honor is a really something to be really proud of. So whenever you were diagnosed, or not diagnosed, whenever you ended up with Susie, were you, it's going to sound weird, but were you single at the time?
I was like, yeah, that's a good question.
So
I was actually married.
What was that like? Oh, you were married. Okay.
I was, yes. That relationship was that's long gone. Yeah, so he actually had colitis himself, which was diagnosed when we were in a relationship. So he was actually very positive, and he was great. He was phenomenal and really helpful and understood, and he was a nurse too. So I was lucky in that respect. But obviously when I met my husband, Tom, I was very nervous about telling him that I had a stoma. Because I thought, why would a guy like him find me attractive? Like, to be fair, I was really like, oh God, you know, how do I tell him I've got a shit bag? But what I did was I talked to him on the phone about it, and I sent him some links to look up, to Google, like to look and Google stuff about ileostomies and stomas and Crohn's, and he was fine. I think it was all in my head. I'm like anybody else. It was just that I've got a bit of extra baggage.
Yeah, well, at least you can always say you've got all your shit in one bag.
That's it. You know it. I got my shit together. So, yeah, that was a bit, it was very nerve-wracking. I'm not going to lie. That was probably pretty hard.
Did you feel it built up a lot for you, or did you feel it was ever like an obstacle that was maybe preventing you before maybe you met Tom?
Maybe a little bit. But he's actually really empowered me to share Susie with the world, whereas I felt that I couldn't do that in my past relationship. So he has, like, he's totally embraced it. I'm not saying that my, you know, ex did that, but with Tom, I really feel like he's empowered me to be like, put it out there, do it, you know, like. So I'm really grateful for that, because I probably wouldn't be here talking to you about Susie. I never really shared too much on social media until a few years ago, until I really started feeling more comfortable and loving myself a bit more, I suppose. So yeah. So
And I think that's I think it's like what you're doing is really important as well, because it just gives it allows people to feel more comfortable in doing it themselves, and therefore like reducing that sort of tabooness around the topic, which is, I think, again, it's making it more mainstream, making it more common, that it's less of a surprise. What do you think? What do you think the hang up is? I guess, do you feel like it's a fear of rejection, or it's something else that sort of comes over as a grey cloud when we start looking at, oh my goodness, I've met someone. How do I tell them that I'm not normal?
Yeah, I think it is rejection, and I think it's them thinking that you're gross, or you smell, or obviously you don't. But I think that's just it is. It's definitely rejection. Like, they're going to think I'm weird, or we all do it. It's different methods.
Yeah, it's kind of strange. It almost catapults you back, I think, to being like a child again in the playground, and you're like, oh, I don't want to have the bad cooties. And it's just interesting because, like, when you think about it in that aspect, it is kind of childlike. And I don't know what your thoughts are, or what you maybe say to other people, but it's kind of, and it's easier to say when you're not emotionally involved, I guess, as well. But it's like, if that person doesn't like you because of that, do you want them in your life anyway?
I wouldn't
I don't.
personally.
Yeah. So it's like a really weird sort of process, I think, where you've got to make that decision. Like, can you spend like 20 years of a marriage hiding your ostomy? Nope.
No way. How do you have sex? You
Yeah.
couldn't, or you wouldn't be. You wouldn't have an intimate relationship.
Yeah.
That's a question I often get asked. It's like, does sex impact, my stoma? But, well, does it get in the way? I'm like, well, not really. It's just extra. Some people tape them up. I just fold mine up, and it's fine. I don't think it makes me. I don't think it makes me less sexy. Like, obviously, I think I've always said this, like, confidence is sexy in itself, and when you're confident of having a bag, just that's cool. But yeah, it's fine. I have no problems, and I think
one of the
most
things that's
people don't.
interesting about that is obviously Australia is famed for its beaches, and I was just wondering, actually, like, what was it like for you, bikinis and the like, and how was it work to get comfortable like that and be comfortable in sort of intimate situations?
Yeah, I think so. Yeah, in Australia, obviously, everyone goes to the beach. So in terms of, I wear bikinis, and if my bag hangs out, it hangs out. If I'm at the gym, if people see it or they see my scars, I'm like, nah, I don't. Like, I've really, really worked on that and my own self-confidence. But I don't know. I think more people in the world. I was actually talking to my friend about this last night. Are embracing all bodies. I think that's really, on social media, it's becoming more popular, that you don't have to be this thin person, that's toned and chiseled, and that everyone is embracing all different types of women, whether they're a bigger size or short, or they've got cellulite or whatever. I think that's changing. Have you seen that on social media? That a lot more people are posting about empowerment and to accept all
Yeah, I've seen
types
it. I
of.
think there's a couple of things, a couple of movements that I've noticed as well that have sort of expanded. It seems to be more in the sort of in the women's space. I think it's something I'm quite jealous of about womankind for, is like, um, particularly within a social circle. I'm not too sure about in a professional circle, that there seems to be much more of a community of womanhood,
Yeah.
and empower, and like that sort of empowerment, which is interesting, because like within womanhood as well, it's like women. I notice whenever, girls talk to each other, they want women to feel empowered and to feel like they belong in a space which may not be ordinarily or characteristically a woman's space, whatever that may be. But what is interesting is that I always find that the person that is putting themselves into that position is always very humbled and would say, like, I don't believe that I should be in this space. And it's almost that strange flip of I don't feel I belong makes women, the other women around that person, rally harder, but they have to show themselves almost as that they don't feel comfortable and they don't feel confident. And then women are like, no, you must feel confident. But then sometimes when it's a woman that feels confident, they're like, who does she think she is? But but it's just an interesting observation from a male perspective. But yeah, there's loads of it. There's I think there's a girl called Jamal who used to be a radio presenter, might still be a radio presenter, but she's really big in the UK. And does a lot of stuff like In Your Own Skin and has a really good Instagram page actually, talking about this sort of the platitudes of conventional media and how it stereotypes how people should be and tries to really promote certainly women in the main of all sort of backgrounds and all sorts of body shapes and types. And I think it's really important, like, you know, even for men, like a lot of men struggle with body dysmorphia.
Yeah.
Which is interesting. Like I probably have an element of it. Like whenever I would have been training, I never felt that I would get to the size that I wanted to be. Whereas, like, you know, I could lift heavy weights, I could do a lots of things, like compete at elite level sport. You know, I'd have a six pack and have muscle tone, but I was never as big as you know what I mean? I was like, oh, why can't I get bigger? And that would be a frustration, not to the point of mental health. But I can see where people really struggle with it. Like I was never content with my body type. Whereas weirdly, recently, we're kind of getting off topic onto me here, but weirdly,
I actually have something, to add to that.
Weirdly, a friend or a person that I know from high school, he sort of messages me occasionally on Facebook, and we kind of have chats and stuff. And he struggles with IBS, and I think has some other sort of thing where his confidence has maybe been challenged. And one of the things he said to me was, whenever I was giving him some sort of like mate's advice, he goes, "Oh, is that because your life's perfect, you know, and you've got an awesome body and you know," and I started going, whoa, where is this coming from? And like, but then you're the person that we only carry our own sort of scars, I guess, and our own baggage, and from the outside, it may well seem to somebody that, like, look at that guy in comparison to myself. Like, and I think that's where it comes in, is when you start comparing your own. I think that's where I heard a really interesting quote from, I can't remember the person who said it, but I've watched a lot of like mindfulness podcasts and things like that, certainly more recently. And it's talking about never judge your inside to someone's outside. Basically saying, like, you know your inside, you know your inner struggles, you know what your baggage you're carrying, and you feel that, and you feel that. But what you see when you compare it to someone else is only their exterior. You only see the surface. You don't see the whole sort of baggage and scars that they're potentially carrying. You just see what you perceive as maybe perfection.
That's very interesting. Makes a lot of sense.
But yeah, so what's your thoughts? What's your thoughts on that, and people sort of talking about it? Because I guess it happens as well. Like I know plenty of women that do like to have a good old gossip, and being married, I can hear, you know, my fair share of it.
Yeah, of course. I think everyone wants in terms of body, everyone wants a perfect body, but what is a perfect body? Do you know what I mean? Like, if we think about that, you know, well, what is it? who's it perfect to? Who are you trying to? You need to impress yourself before you want to be impressing other people, I think. And the whole body dysmorphia thing, which I was going to touch on, which you spoke about. I mean, I think to some degree I've had it or got it or whatever, like being, a young teenager being on steroids. I have, photos of me where I'm huge and I, had the acne, had the works. And your body, you just fluctuate all the time from being on steroids, and it just plays with your mind. And when I was last year I focused on leaning right out for the wedding, which I achieved. Now I've been a bit more relaxed, and now I'm like, oh my god, am I big? Because that I always I think that stems back from being on steroids. And that's like, I would be non-compliant with medications. It's very naughty because I didn't want to take them because I didn't want to be big. But then my Crohn's would suffer, but I didn't care because I didn't want to be big. That's terrible. I know other people that have, I've spoken to other Crohn's girls about that, and it is somewhat common. I know that's really bad, but
what do you think drives that?
I didn't like the way I looked. Because of the steroids, I was huge. And I didn't like the way I felt. So I thought, if I don't take the steroids, obviously I won't be big. And I'm like, I don't care if I get diarrhea. I know that's so bad. I know where it comes from. I wouldn't, I'd never tell my patients that. Don't, take your medication. But I know other women that have done that. But
yeah, but I guess that's when you get entwined
terrible.
within the emotional struggle and the logical struggle. So you logically, as a practitioner, you never advise, and you've clearly said that you're embarrassed about the fact that you chose that path yourself. But then again, it comes back to that. As a practitioner, generally we try not to be overly emotionally involved. And therefore, you've always got a clear. I feel you've always got a clear. Well, I say a clearer perspective, a logical perspective to the process. Obviously, if you lack too much emotional involvement, you become a very bad practitioner because you're not able to meet people. But the interesting thing is when it becomes an emotional topic and you're led by the emotional side of your brain, and it's a difficult, necessary but difficult path to walk. I think I just wondered, what was the things that were making you feel big? Because were you in the 90s here, or are we in the 2000s?
Yeah, but 90s, late 90s, early 2000s.
Yeah, so one of the things that impacts a lot of people currently is social media and social media trends. But I'm just wondering, this isn't a new thing, but it's more, it didn't just happen in 2012. And the impact of people having issues with how they feel they appear hasn't just happened all of a sudden. So for you, what were the sort of things that made you feel like that, do you think?
I think other girls at school obviously were thinner than me, and they always sort of questioned why I was bigger, and they didn't understand. I remember going to my 10-year high school reunion and no one recognized me because I was healthy. Obviously I had Susie, and I looked great. And they're like, oh my God. I'm like, yeah, well, I was sick, but I didn't tell everyone I was sick, and I knew the people that were close to me. They just didn't understand. So I wasn't going to share that with everybody. But I think that, social media there was no social media when I was in high school, and I'm really grateful for that. But we had, magazines. So everyone would get the Dolly magazine, or I don't know, Cosmo or whatever. And, you'd want to look like the girls in the magazine. So that's probably, and I, to be fair, that nurse didn't really help my situation, telling me I had a fat face. when she's giving me IV steroids. I mean, who says that as a nurse? It's horrible. I won't forget it.
Yeah.
If I saw her,
Yeah.
I would, yeah.
It is crazy, like that someone would have, like, particularly a nurse would have said that.
No,
And and put you in a position to feel like that from the person you'd expect to make you maybe feel better about situations.
no. It was horrible. It was horrible. So I've shared this story before, actually. I once had, speaking about body positivity. I don't know how it was now, maybe 5. No, it would be more than that. Maybe 7, something like that. I was working my current job, and we were all in one of our offices, and we were talking about one of our patients who had to have a defunctioning colostomy because they had cervical cancer, and they had cancer had spread everywhere, so they gave her a colostomy to bypass the bowel because she couldn't poo normally.
Needed to rest, yeah.
Yeah, so we were discussing her case, and this registrar that I was working with piped up in front of everyone and said, "If I had a bag, I would kill myself." Everyone turns to me because they all know, all my work colleagues. This girl didn't know because we have rotating doctors that come through. Obviously, they need to learn different areas. And they all turned to me because they knew that I would say something. I said something, I'd lifted up my shirt. I was like, "I've got one and I haven't killed myself." Well, you should have seen her face. It was priceless. I don't think she'll ever say that again, but yeah, that was pretty funny. I just thought, why would you say that? I don't know why people say weird things like
yeah. No, it is. It's interesting. It can really damage someone. It really can. I think it's irresponsible, I would say.
Very, but yeah, comments like that can really damage a person's mental health. But me, I'm confident and was confident with Susie, and I'm really grateful that I did that, and I don't think she'll ever forget it, and she won't ever say that again.
Could you forgive her?
Yeah, 100%. Yeah,
because I think that's an interesting part of certainly my feelings in the current world in general is like there's a lack of we're in a space where I think people are moving in a good direction in recognizing, like, being body positive, being aware of disabilities, or I don't know, disability, I think, and it's not a comfortable word for me because I don't feel like I'm a disabled person. And that, obviously that's more work in me and my perception of what it is to be disabled. But yeah, there's a lot of work where we're trying to have a more even keel, but there's to a point though where I feel there's a lack of a two-way communication. There's a lack of, you don't understand me because you couldn't understand me. Well, if you can't understand you, then what's the point? So, do you know what I mean? I think there needs to be an ability of, you don't understand, which is fine, but we can help you understand. And then there's a communication, and there's a dialogue potentially created there. Whereas at the minute, I feel like in some circles and in some contexts, people just get shut down whenever they come from a position to say something stupid like that, or something that is ill-informed or maybe ignorant. And the bigger case is to educate, talk, have a dialogue. Why is that not a reasonable response to X, Y, or Z? And in my mind, in that form, and again, this is probably me coming from a slightly male autistic place, I don't know, that you would encourage someone to maybe adapt or change as opposed to reinforcing the behavior. Because if you turn around to someone and you couldn't forgive her, and I'm like talking about a stoma is a slightly different context, but someone talking about being fattest or something like that, and talking to them and educating them that, if you sort of chuck it back in their face and you just don't understand, you never understand because you've never been fat, you've never walked in my shoes, well, they're never going to want to understand. And I guess it goes to all types of different things, but essentially what I'm talking about is forgiveness, and the ability to forgive is is more important than the ability to give insult, I think.
Yeah. Yeah, I just explained the reason why I had a stoma, and she was okay with it. And I just, yeah, I don't hate her for saying that, but I just think it was irresponsible of her to say that, especially in her profession.
I'd say it does surprise me, like how, but then I guess at the same time, we're just humans that have done a degree or a course, and it's sort of like, as much as like, oh, the amount of times like physios just say stupid stuff in clinic, and you're like, oh, why would you like just like, one of the things I notice most, and it's more in the sort of the sort of physio exercise physiologist space. Maybe because it's competitive, I don't know, or we're fighting for scraps, I don't know. But it's just like, sometimes people can be very quick to blame another clinician or say, oh, I don't know why they did that. That's a stupid thing to have done. Yeah. Based on what you're saying now, but you weren't in that treatment bay whenever they were doing that treatment. You know, so it's like, a surgeon, a consultant of mine has said it before, going, oh, I don't know why he did that. I don't know what. And I'm like going, well, that's now just made me really doubt the whole process. And all you've done is maybe slated someone who probably did the best they did at the time with the information that they had.
Exactly. So true.
Still doesn't improve anything that you just said about that. There's no getting around that. That's just that's
no. There is no way getting around that. She was very sheepish after that. It was I love telling that story. I think it's so funny. Like, I can laugh about it now, but oh god, at the time I was really angry at the time. But
so how do you think, what sort of stuff do you think we can do to improve body positivity, or just to make people more comfortable in their own skin? Like, what's your take on that, and how do you make it go or take it forward?
I think for me, I think it's about embracing the body that you've got and working with it and loving it. Because if I didn't, like, for me personally, if I didn't have Susie, I probably wouldn't be sitting here talking to you, because I was, really sick. I forgot to mention, I did have precancerous cells. They were already starting to develop in my large bowel. So I, was really sick. So if I didn't have Susie, I wouldn't be here. And I just think that's so important, to just embrace what you've got and just love on your body in whatever way you can. I think you need to, I don't know, that's probably the main thing, that I would just be grateful for what you've got. Because for me as well, being a nurse, I see so many sick people, and I think I'm freaking lucky. Like, really, I'm so lucky compared to other people that I look after. And so just embrace it. I think really, that's my bottom line.
Yeah, I think that's such an important thing, particularly, I think, coming from an IBD perspective. The sort of the ostomy pathway generally, well, in current medical situations, is generally not elective surgery in the way that, say, a breast implant would be, or a cesarean at pregnancy. It's generally, moving in the direction of, this is your only option if you want to have any way decent quality of life. And whenever you think about it in that way, sometimes you don't really have an option. There's not really that opportunity to say, actually, no, I don't want this. Be able to sort of live, I think, is that, I'm not sure if that's the way I'm wanting to phrase that, but essentially, for people in the IBD community, having an ostomy is literally, it's a second chance at life. And I think it's a really important aspect. And I think that whenever you're able, like what you've just said, able to harness that, it can lift you so much higher than you maybe could be. Because realizing you've got a second chance, it may make you feel different about a lot of things, not just your body image. I know certainly, like, soldiers, when we've come back from combat missions or had significant battle injuries, particularly with the guys I've worked at like places like Headley Court, their perspective on life after having life-changing battle injuries, which are visual or non-visual, has changed who they completely changed the direction in which they are going. And one of the main ones, ironically, my wife was talking to me about him last night, is a guy called Mark Omrod, who has basically been in the Invictus Games. He is a triple amputee and has only got a partial hand left on his existing arm. And he is one of the most positive people that you would ever meet. And I'm not saying you don't need to have been affected in that level of extreme, but it's just like his outlook on life, and actually his perspective now, having gone through all of that, is actually, if this didn't happen, I would never have achieved all of this. He would probably still be he'd be a Royal Marine, maybe a corporal, maybe a sergeant. And not that he would have been unsatisfied with his life, but the life he's got now, he is convinced that his life is so much better. And that's a really interesting thought. And I think it's something that I can relate to with my IBD surgeries. And I feel that you've sort of related to that as well. And I think I don't know, how do we convince people to get to that stage? How do we get people to realize, wow, you've got a whole new opportunity?
They have to do that themselves, I think. I don't know, it's hard. You really have to work on yourself, and you're in a, I don't know, strength or ability to, I think it's about loving yourself and loving the reasons why, I don't know, how you got there. Like, I suppose that's, I don't know, it's hard. I don't know how to tell someone to be positive. I don't know, in me, I've always been a positive person anyway, but it is, I think, like you're saying, when you go through an experience and come out the other side, then you really can embrace all of that, and you are grateful for what you've got. I don't know. That's a really hard one. Probably can't answer. I don't know. It's tricky. It is tricky when you really think about it.
Yeah, no, it is. It's. I think it's almost. I guess it comes back to like the stages of grief and having to work your way through that process. And at any point you become sort of stuck. I guess it's just you're never going to do it unless they want to do it. I think that's the ultimate sort of thing. And it's just, I guess it's again just having dialogue. It's having that open conversation, the ability to talk, I suppose. Getting on the topics we're probably not very qualified to talk about, but
I know, I'm not a psychologist.
I do find that process really interesting, like, because obviously I deal with a lot of people that come through with injuries of a sort of MSK nature or musculoskeletal, so bones and muscles people. And one of the interesting things for there is like chronic versus acute. Chronic generally is always harder because they've gone into a psychosocial model, whereas acute, they're kind of like, it's just an injury, I'm going to get through it. So low back pain would be one of the ones. And actually Australia's health process system has done a lot of work in addressing sort of low back pain and sort of the psychological aspect of pain and how that sort of can manifest itself, which is another interesting sort of thing in itself. But yeah, it's almost, you almost need to want it yourself and recognize it in yourself to be able to take it forward. Because even if you were to sit down with a psychologist, if you're still in denial or still in the anger or bargaining phase, you're still haven't accepted your situation. And it's
I agree.
Yeah, I'm really diverging this morning, really diverging. So one of the things, getting back on the sort of off topic, I guess, is you mentioned that you are trying to get pregnant.
Yes.
Or are pregnant.
I'm not. No. I went out drinking last night. Let's hope I'm not.
So what's the process for I understand there may be parts of this you may not wish to discuss or disclose. The perspective in pregnancy, maybe touching on your experiences as a nurse and just generally as a person, like what's your understanding as a woman about IBD and pregnancy and the process you're going through now?
Well, for me personally, I'm happy to share that with you. So, I mean, given my age, I'm 35, so I'm not a spring chicken. It's a lot harder as a female. Obviously, after 30, your eggs deplete. Oh, thanks, Sam. That's a cute comment. Thank you. I think what's happening for me mechanically, I've actually got quite a few adhesions that are causing infertility. I don't know if that's the case for other IBD people or people that have had stomas. I'd love to know. I do have a friend that she had her freckle a week after me. Her name's Sarah. It's so funny. We're only a year difference in age, and we met through our surgeons. We're the same surgeon. We still catch up. So she had both her little girls through IVF, but she had other issues as well. So for me, I think that's what's happening. We've been through a series of tests, and my gynae said to me, "We're not doing a laparoscope on you. You're too tricky," which I knew that they don't want to be poking around down there just in case they nick my bowel. And, you know, I've only got one now, so I need it. So we're just about to start the IVF process. So next month we will we'll be starting that. I don't know. Mechanically, I don't know. I think they're not working. They're not really, it's quite painful. Yeah, having these tests has been pretty tricky. So what happened to me initially when I had Susie, because they were going to do the J pouch, they left my rectum and they sewed it to my vaginal wall. I think that's a common procedure when they do the surgeries for females.
Okay.
Yeah, so that's what my surgeon told me. And so what's happened, and then they obviously when they removed my butt in 2010, they took it away, and then there's adhesions there. And I think it's quite, my gynae described it as sticky down there and really tricky. So, I haven't told too many people about that we're going to do that. I'm happy to share it on this forum, but we'll take it as it comes. So I would love to share my journey with everybody on here just to help other women. And I'd love to know, obviously, if other people have experienced that. I've seen, a lot of other women on our pages that have had babies with their stomas, and that's awesome. So I know it's going to happen. Everything else is working fine. I think it's just mechanically I'm a bit stuck. So, and I know that I have to have a C-section, and I'm a high-risk pregnancy in that respect. I don't care that I have to have a C-section coming out the sunroof, as I like to call it. I don't care if I have to be put under anaesthetic to deliver the baby safely whenever that happens, because I think I would just be grateful to have a baby, to be fair. So we've been trying for 7 months now, which isn't a long time in terms of trying to conceive, but when you're 35, I'm nearly 36 and have had, surgeries down there, it is tricky. So they actually say in South Australia, they've said if you're 35 plus and been trying for 6 months, then you need to see a fertility specialist. So I've had, numerous tests leading up to about to start. So I've always sort of known that this would probably happen. Like I'd always sort of knew that I'd probably have to go down this route, and I honestly don't. It doesn't bother me one bit. Like Tom said to me,
anxiety?
Oh, say that again.
Anxiety, when you were starting to try, and well, obviously it's still a short period of time in the world of trying, I suppose. But was there any anxiety for you guys when things weren't working out? Was there anything like that happening? Like, were there any feelings of a lack of womanhood or anything?
No, I haven't, because I knew I was a bit different. I haven't felt like that yet. I mean, I'd love to fall pregnant naturally, but it's just not going to happen. And I remember Tom saying to me, "Are you a bit nervous about today?" When we were getting our results of our fertility. So we had I had a blood test, and he had to do his thing. And I said, "Babe, I've been getting bad results since I was 13. This has been nothing." I just roll with, honestly, I just roll with the punch.
Yeah.
When you've been sick your whole life, basically,
Yeah.
you get used to it. I literally said that to him. He just laughed. I said, it will be what it will be, and then when we had the appointment this week with the gynae, he's like, "I think you have to do IVF." I'm like, "Well, we sort of already gathered, so we're not disappointed about it," because I think I always knew that this was going to have to be my reality, and that's okay. I don't really care how I get this little one. Just want, yeah.
It is, and it's I think that's the more important focus. Like I say that again from an uneducated position, but I think I've noticed that a lot of women put a lot, maybe it's just people in general, but they put a lot of pressure on themselves, and actually up to the actual conceiving part where a man is generally involved, or at least the semen. It's very stressful for both parts of that heterosexual couple. And I think people put so much pressure on themselves, and there's so much, I'm going to call it fear. I don't know whether that's the right term. And that's the fear of being your biological self. I don't know. It's like a lot of women I know, men about it, but a lot of women that I know feel that they're feeling as a woman, and they're not a real woman. And I'm like going, how can that be? How can you perception of yourself?
Yeah, no, I haven't felt like that. I've definitely been upset that it hasn't happened yet. Probably because I'm a person that likes things done then, and that's me. And I've had people just say, if you relax, it will happen. I'm like, but I'm different. People don't get it. Or people say like, "Oh, maybe you're overthinking it," or, "Do you really need to do IVF?" I'm like, "Well, yes, my insides. Have you seen them? Because they're not really cool." So I just don't like people telling me how to think and feel. That's one thing I really don't like. I don't feel less womanly at all. I haven't felt like that. I don't think I will, actually, because, again, I just keep remembering about how far I've come in my health journey. So for me, it will just be an absolute miracle. And like medicine, how good is it? And how good is IVF? Like that, people that have experienced issues can still, conceive with having modern tech. It's just amazing. I just think I'm lucky that I get this opportunity, and I can afford it too. It's a big process. It's just amazing how they do it. I'm really excited, actually. I'm probably I am nervous. But look, many people have done it before me, so I'm not the first, won't be the last, and it's okay. I would love to share my journey along with you, because I think that would really be helpful. I think maybe to other women out there.
So with I don't know if you are able to know the answer to this, but I'm curious to have cesarean with an ostomy, like what. There's got to be obviously some complications with that. Because where a cesarean scar would normally be isn't too far away from where they may have done, and it's not too far away from where Susie might be sitting. And I'm just like, have they chatted about that? Because obviously, if you're high risk and it's likely that.
Yeah.
What have they said?
Well, they said that I'll probably have to have my surgeon in the room, like my colorectal surgeon, or he will get the surgeon report from him I would prefer that the surgeons in the and you know what, I actually get to choose what hospital I want to go to. That's the beauty about private health too for me.
Yeah.
So the hospital that, this is probably me being a nurse and being, a bit, knowing too much. The hospital he normally consults at does not have an ICU, and I would prefer him to go to a hospital with an ICU. So I get to do that. I can choose. So that's pretty cool.
And is that a real fear that you
Yes,
might end up in ICU?
definitely. I'm scared they're going to nick my bowel, like, to be completely honest with
Mhm.
you. Because everything's dropped. So every time I have a scan, an
Mhm.
internal scan, or all they see is my bowel. Like a few weeks ago, I had one. They could only see my left ovary, couldn't see my right because it was just bowel in the way. So
Mhm.
if you think about, I've had like 11 years of just dropping, everything dropping and just sitting
So
there.
is that where it's fallen backwards, so to speak, because it hasn't got
It
the
has it has gone backwards and it's down and it's just all covering my bowels. Just they couldn't see my right ovary. They could just see my left.
Mhm.
Um, and yeah, they tried to do a scan where they could check the patency of the tubes, but it was too painful with all the adhesions there. And I'm pretty tough.
Mm.
Like, I think,
Mhm.
when you live with a chronic illness, you build up a resiliency and tolerance for pain, especially pain. But I just couldn't do it. And my gynae's like, "Oh, I'm so sorry I put you through that." I'm like, "Oh, look, I gave it a red hot go, but I just couldn't." I probably nearly kicked the gynae in the face. I was like, "Nah, you got to stop."
Yeah.
Oh, but it's
But
okay.
this is an aspect of women's health, within IBD that
Yeah.
this is fascinating to me because I was never like, whenever it's explained like you've just explained it, it makes complete sense.
Mm,
But it's that kind of a complication I'm just not aware of, that
yeah.
your sort of reproductive organs can drop back. It's not
Mm,
obviously, if you have an anatomical understanding of the body, if you remove something, that's that if you remove a wall, then what's resting on the wall is going to fall back. But
correct.
it's just such an interesting, like, in my head I'm going, well, is there not a way that they could maybe pack something?
I don't.
Or but yeah, like, so what is the sort of their thoughts? Because I don't know how much I want to talk about it, 'cause I don't know how much I'm going to put you into fear, but
Well, oh
it's
no,
like
that's okay.
carrying term
I
and
think carrying
complications too.
I think carrying will be okay. I think
Mhm.
from what I've seen on, Crohn's mummy, she carried with her second
Mhm.
little girl, I think, with a stoma. Obviously, your stoma size changes, so my stoma will get bigger.
Mhm.
Emptying might be a bit tricky because you can't really see. I think you have to deliver earlier, which is okay. I don't really care. Like, honestly, I'm probably really nonchalant about all this. Um, yeah. Oh, thanks, Kylie. Um, yeah, I don't know. I, d- to be fair, I don't know if my gynae knows everything. Like, a lot of other women have done it. So that's probably what's given me a bit more hope that I'll be okay. I don't
Mhm.
know. I'll just roll with the punches. I honestly will. That's how I've always dealt with things. You just got to, this is what's happening, sort of deal with it.
Yeah, no, totally. And I
I
guess
think
that's
sometimes,
like,
mm,
for sure. And I guess that's the important perspective. You're not the first. Like this, there is a
yeah,
history, a positive history of successful pregnancies with people in
yeah,
your situation. I think that's the
yeah,
focus. It's just, I think for me, it's because it's new information to me. I'm like going,
yeah,
what? Wow.
yeah, I know. Um, Yeah, I don't know. I don't know. It'll be interesting, but I am excited, and I'm excited for it to happen, so I can share with the rest of the IBD world. Um, I think that's important, and I love it when I see other people, other women that are pregnant with their bags. So I think it's pretty cool.
Well, I think that's
Watch
one of
this
the big positivities about social media, particularly for our community, is like
Yeah.
how much more visible, I guess, we've become,
Mm.
and how much more interaction we generally have with people experiencing it, as is. Really, I don't know. I don't know. Like you've obviously already mentioned about seeing the likes of Crohn's mummy and Paulina as well, who's just
Yeah, Paulina,
had her
yeah.
baby.
Yeah.
And you know, there is so much out there. I'm like, what's your take on social media for us? Is that something you would advise people to get involved in?
100%. Because when I first had Susie, so it was 2009, there was no, I don't think Instagram was around or hadn't sort of hit here. There was Facebook. But the only person I met having a stoma was my friend Sarah, who had hers the week after. I had no one to talk to before. I literally had no one. So now I love social media because I know I've helped so many other people. You probably get the same people messaging you all the time for questions or how do I do this or and just normalizing having a stoma. So it's so important. I think it's really helped me too. And I love the community we've got. It's awesome. You know, I wish I had that
Yeah,
11 years ago and I didn't,
I think what's
you know?
one of the nice things is it's like I don't want to call it a clique, but it's one of those like positive groups where
Yeah.
every people rally. So there is a lot of negativity, and if you go into a lot of the Facebook groups, there is people are talking about their woes. But then if you take a second to maybe go into the comments, you, although the person talking or the person posting is in a low place, the people that are generally responding from a place of positivity and love, which is
Yeah.
amazing. Do you know what I mean? Whereas,
Yeah.
you know, there's every risk that someone just double down on you. Whereas my perception within the IBD community is that everyone just really channels support and lets you know that you're not alone, lets you know that that's not unusual potentially for IBD or that it'll pass. And it's just, you know, it's such a lovely thing to be part of. I've reached the part of the show. You'll be pleased to know we're coming towards the end now.
I've loved every
The
minute.
part of the show I call this the three truths. So Robert off a guy that I follow called Lewis Howes, who does a sort of business mindset podcast. Essentially, the way it works is it's your last day on earth, many years from now, and everything you've ever created has disappeared. So all your social media and all that kind of stuff has disappeared. But you have the opportunity to leave three truths or three life lessons that you think the world should learn. What would your truths be?
3 truths to leave behind. That's really hard. I've never been asked this
It is.
before.
It's cheeky.
I think to be grateful for every day that you have. That's what, and I've probably said that throughout our conversation today. To love yourself and others is very, I think, a truth. Especially like loving people how you would love to be loved. That makes sense. And the third one is always have fun. Because if you don't have fun, what are you doing? Just that's probably it.
Yeah, no, that's beautiful. I think it's always interesting for me to ask that question and to see what people come back. And do you know what? Like there again, there's three very honest and really good sort of things to live a life by. You know, like being grateful is such an important aspect, I think, because when you come from a place of gratitude, it's very difficult to not have a positive outcome or relationship with it. It's almost like you take ownership of it. And I think love yourself, but within the pretense of loving how you would want to love, almost like the sort of parable about treating the neighbor how you want to be treated.
Yeah.
And then having fun. Yeah, I think being able to have fun is so important. I fail at that quite a lot sometimes. I need to remind myself you're meant to be having fun. So yeah, no, they're
Oh,
beautiful
yeah.
things to sort of to do, I think. And yeah, you've really sort of honed that, I think, during this discussion, talk, like everything, it's clear that those are actually a lot of your perspectives on how you take on life. And it's a beautiful way to take it. I'd like to say a few seconds just to appreciate yourself, Sarzi, like the stuff you do, community, the people, as young as it may be, only a few years old. I think it's such an important aspect, and just having that approach, which is clear in your page, like having that, being so grateful for everything that life is throwing at you, and just embracing who you are and showing off Susie to the world. It's a really, you might not, someone said it to me before as well, you might not realize how much of an impact you're having. And yeah, I'm just really grateful for you to come on and share your story, hopefully alleviate some worries for women that are going through IBD, and certainly women that are thinking about pregnancy and stuff like that. So thank you so much for coming on.
Thank you so much for the opportunity. I've loved every minute. So no, I feel very grateful that I can share my story, because hopefully it will help someone somewhere, in any aspect. So yeah, just whoop it up, as I say, have fun, and I never take myself seriously, as you can tell. So if people follow my social media page, they'll see that. Yeah, thank you.
I'm gonna go to I'm gonna fling a Van Wilder quote out there. Never take life
That's a great
seriously,
movie.
because you'll never get out alive.
That's gold. That's such a good movie. I love it.
It is. And you know what? The best thing about it is, like, surface level, it's college kids getting pissed up. But actually, if you watch it, there's so much deeper meaning in there. Just there's so many takeaways. So many takeaways. Okay, guys, that's the end of the show. Hope you enjoyed the chat with Sarzi. I think it's been one that has reached far across the spectrum of the discussion. I may have waffled a bit, so to fast forward. But yeah, I think we've had a really good chat, and it's wonderful to have Sarzi's perspective as a nurse and an IBD patient. And certainly the stuff that we've talked on within sort of pregnancy and IBD has been really interesting. Another education for me as a humble man. So we'll catch you on the next episode. Don't forget to like and if you want to, share it to those who may need it. So thanks for tuning in, and we'll see you in the next one. Bye for now.